we are honored and privileged to have some of the greatest champions of health, humanity, and social service in this inaugural session of 2-day-long summit. Their thoughts and actions have helped build movements of social responsibilities towards health and environmental causes and made world more livable for millions. Let me welcome our very esteemed guest of the day, Dr. Bhaskar Chatterjee, a man who is widely respected as the father of CSR in India. Dr. Chatterjee is a former Director General and CEO of Indian Institute of Corporate Affairs. A former bureaucrat, he was part of the team responsible for shaping India's response to the global economic crisis of 2009. He is also a prolific author and a well-known public speaker. Thank you so much, Dr. Chatterjee, for joining us today. We also have Mr. Atul Bagai, Head of Country Office of United Nations Environment Program, UNEP, in India, and is a veteran sustainability professional. Prior to the UN, Mr. Bagai has worked with the central and state governments in India. Thank you so much, Mr. Bagai, for joining us today. We are also honored to have with us Sadhvi Bhagwati Saraswatiji from Parmarth Niketan Ashram, a spiritual institution based in Rishikesh at the foothills of Himalaya in India. Sadhvi ji has been closely working with Swami Chidanand Saraswatiji, a lifelong crusader of health, sanitation, and environmental causes, and who has also founded Ganga Action Parivar and Global Interfaith WAS Alliance. We are happy that CSR Health Impact Awards 4th edition is also being supported ideologically by Global Interfaith WAS Alliance. Sadhvi Bhagwati is the Secretary General of Global Interfaith WAS Alliance and President of Divine Shakti Foundation, another landmark initiative from Parmarth Niketan to promote women empowerment and well-being. So I welcome Sadhvi Bhagwati Saraswati on this very important discussion. We are delighted to have Mr. Jack Sim, a personality famous across the world, and for something which he pursued with all his passion, and the cause of getting a toilet for every family and for every human being in this world. The founder of the World Toilet Organization, a groundbreaking initiative that won many awards and accolades around the world. Jack is a source of inspiration for millions who wish to make a difference in their life. In 2006, Jack was invited to launch the German Toilet Organization, and he is also a founding member of American Restroom Association. He has been named as the hero of the environment by the Time magazine in 2008, and Jack is also part of the World Economic Forum's global agenda for water security and for social entrepreneurship. Thank you so much, Mr. Sim, for joining us. We are really delighted. I'm sure it would be almost a noon or afternoon in Singapore. So thank you so much for sparing your time. Dr. Hema Divakar is another very important guest in our this discussion today. She is the founder and medical director at Divakar's Specialty Hospital in Bangalore, which is also the first private hospital in Karnataka to obtain ISO certification. Dr. Divakar is a women's health champion and has a keen interest in high-risk pregnancy care. She has been consistently working with Government of India, state governments, and many other organizations, including ISW Council, to spread more awareness and help more women to get health care where they need at when they need. Thank you so much, Dr. Divakar, for joining us. We also have Dr. Rajiv Gautam, the president of Horiba India. The company under Gautam's presidency has taken a leading role in establishing partnership between the industry and academia and is consistently working towards making greater social impact through its innovation and business. Thank you so much, everyone, on this very special show. So before I go forward, I would also request our online viewers today to keep sharing and liking these discussions, and share on your wall, make so that these inspiring words from these very special people can reach out to as many people as possible. So let me begin with Dr. Bhaskar Chatterjee. Dr. Chatterjee, you are the one who actually made India become one of the world's first country to recognize CSR as something very strategic contributor to transform a country's fate. And how people from private sector can actually contribute to the building of a nation. So I would like to hear your kind message, your experience, and how do you see that CSR is going to help our country do better when it comes to health, especially after this extraordinary crisis of COVID-19. Mr. Chatterjee.
Thank you, Mr. Narayan. It is such a privilege and a pleasure to share this platform not only with you, but our very distinguished panel whom you have brought together. Indeed, the journey of CSR has been a very epic one over these last 6 years. As you rightly said, India was the very first country to have mandated CSR for the profit-making companies of this country. And over these 6 years, we have seen a lot of innovation, a lot of traction in the area of CSR. The idea of bringing in that legislation was to give the private sector and, of course, the public sector a role in the development, in building the development momentum of this country, contributing to the nation's development. And initially, of course, corporates were reluctant at having something like this thrust on them. But now I see that they have converted challenge into opportunity. It is they who are driving the entire CSR ecosystem in the country, and their contribution has been indeed seminal. Specifically with respect to the health area, if you look at the CSR pie in this country, it is almost about 16 to 17,000 crores annually. And out of this, about a little over 50% is taken up by education. But a very close second is what we now call WASH, in which you have water and sanitation and health all put together. Ever since our Honorable Prime Minister brought the Swachh Bharat initiative into our consciousness very strongly, there has been a tremendous push towards sanitation and health issues taken together. And I'm very happy that the Council has promoted this so actively, so ably. And in the course of rewarding some of the great achievers through your CSR Health Awards, you are providing a great deal of energy and encouragement to those of our people who are striving so hard at the grassroots to build health and well-being into the very consciousness of our country. We have with us, of course, Atul also, who's worked with UNEP, so he's very well aware of the Sustainable Development Goals. Parallelly, as we brought CSR legislation in 2013 December and made it effective from the 1st of April 2014, the SDGs also got underway, the MDGs finished, and today there's a very strong convergence between the Sustainable Development Goals and CSR. You will see from Schedule 7 that among the activities permissible under CSR for companies, health figures very prominently at number 3, along with poverty and education. And a lot of companies have done a tremendous amount of work in the health and sanitation area. Coming to today's situation, it's quite amazing how much of the COVID battle has been fought on the CSR platform, and how CSR has been converted into a very prominent tool for combating the COVID-19 crisis. You will recall two particular things very importantly, that when the migrant labor crisis absorbed our country and so many of these people had to leave their city employment and go back into the villages, many companies, both private and public sector, used their CSR funds to find them food and shelter and sustenance so that their movement became that much more facilitated. The second very important way in which CSR was used as a tool was by the Prime Minister himself when he created the PM Cares Fund, where a lot of companies have now donated to swell the contributions. And PM Cares today has become at the very forefront of the battle against COVID. A third point which I wanted to make, and I don't want to go on for too long, is the fact that the Prime Minister is also thinking of having health cards for the nation, much in the way that the Aadhaar cards have been issued. And you can see, therefore, how much of CSR and health and the sustainable development goals together form a very potent instrument by which we can tackle the major crisis in all the areas of health and wellness and sanitation. Across the entire country, across all geographies, across all states, the corporate world and the public sector have been stepping out to ensure that health is a priority, because at the end of the day, a nation is as healthy as its population. And we have to ensure that the message of health and wellness reaches out to the remotest, in fact, to the last person standing. And I laud the efforts of your council for all that you have done. I wish you all the very best for your awards. And I thank you again for giving me this opportunity to come on this platform. And a very nice word goes out to Mr. Sims from Singapore, whom I happen to know well, and we have worked together in the area of sanitation. So I'm wonderfully happy that you've also brought him onto the platform. Thank you.
Thank you so much, Mr. Chatterjee. Just, before I move on to our next very esteemed guest, Mr. Atul Bagai, to talk about his perspective, how CSR is helping on environmental areas. You have been a crusader for institutionalizing CSR, and in 2014-15 financial year, immediately after the rule, the new mandate was passed, we saw around 9,000 crore, CSR was being spent, with around 16,000 companies only doing that. In 2018-19, it has been reported as 18,600 plus crore being spent, with the 24,000 companies now doing CSR, and which is, I'm sure that after this COVID trigger, it is going to expand much more. How do you feel when you see something which you have always been trying, and which you have struggled so much to bring forward, becoming such an important contributor to the social life and to the public life of people?
Thank you, Kamal. You cannot imagine how fulfilled I feel and how visionary in hindsight I feel. I remember that when I was first trying to bring in the CSR law, I became the favorite whipping boy of the corporate world. And everybody said, who is this bureaucrat sitting in an air-conditioned room in some bhavan trying to crack the whip on all the corporates? And mind you, these corporates wield a tremendous amount of influence on the whole public policy space. And the resistance to that law was really enormous. Now I feel so fulfilled, because those very corporates are now saying that now we feel that CSR has given us a real opportunity, not just to do it in the way that we used to do it in the past. And I never said that they were not doing CSR. Many were. Many said, we're already doing it. Why do we need a law? What does the government know about CSR? We are the ones who do it, and so on and so forth. But the idea of the law was not to say that this is something that is new. You have been doing it. but do it in a systematic way. Do it in a regular way. And also, please bring in transparency. Show the society, show the nation, show the country what you are doing. How much of your profits are you spending? And please take these decisions of CSR not in the back room, but in the boardroom. Use the finest minds in your company to concentrate on CSR. And that will happen only when it's a boardroom subject. The message that will pass down through your company must resonate only when it comes from the boardroom and engages the highest and the best minds of the company. So I think today CSR has established itself primarily because it is in the forefront of the thinking of our corporate leaders. Thank you.
Thank you so much, Mr. Chatterjee. And I really thank on behalf of the entire council and health fraternity. People like, Dr. Hema Divakar, people like, all those people who are fighting health related issues at the forefront of our country, that, people like you tried and institutionalized a tool which can really make a difference. So thank you so much for doing that. And we look forward that this movement will continue. People will invest in the health of the people, to make this country healthier, more productive, and actually bring the real potential of everyone's lives. Mr. Atul Bagai, thank you so much for joining. And now you as a head of UNEP in India, have been monitoring and seeing the country's role and responsibilities when it comes to reducing the carbon footprint, to make sure that we are coming out as a very, very responsible global citizen. COVID-19 has definitely put us everyone on a very different track. How do you see that going forward? India as a nation should look into the sustainability, environmental issues, and many other related issues which directly impact the health of the people, and also lead to something like these pandemics. So I would like to hear from you. How do you, what guidance you would like to give to numbers of people who are hearing us, and also the corporate citizens?
Good morning, everyone, and thanks, Kamalji, for inviting me and UNEP for this very important workshop or a webinar. And I think you could not have organized this at a more opportune moment than this, considering the pandemic crisis that we are going through. And why I say this is that this pandemic, like a few others in the past, have brought to the forefront the core of the issue which you are highlighting, that while we are talking about health, we cannot ignore environment. The nexus between environment and health is so deep-rooted, and unfortunately, either at the policy level or even at a common man's level, this nexus is not understood. I was seeing the beautiful film you showed right in the beginning, and I think the messaging that has come out is so critical that it should really be outreached all over the country, because we need to understand that environment is playing such a devastating role on the health of the population, that unless we are aware of this and unless we are able to mitigate the environmental degradation, our health issues will not really get sorted out. In your video, you touched upon air pollution, water. I'll just give you a very small statistic. The pollution which you are talking about, it is affecting our health through, as you mentioned, the food we are eating, or the water we are drinking, or the air we are breathing. In fact, approximately 19 million premature deaths are estimated to occur annually as a result of the way we are using our natural resources. So I think our unsustainable global production and consumption patterns, which get reflected in the air we breathe or the soil we till our food on, or the water we drink, is having an impact on health quite substantially. And these direct damage costs to health are almost estimated to be between $2 to $4 billion a year by 2030. I'll give you another example that Government of India, like the other 198 countries who have come up with a recovery plan or an economic stimulus package, each country has come out with that, which is worth billions of dollars. In India itself, it's almost 10% of the GDP, as they say. And I keep on remembering the old adage, which meant a stitch in time would save 9. Had we, in the last 30 to 40 years, looked at our environment degradation issues in a more sustainable manner and spent a little bit of money on sustainability, on ecosystem management, on biodiversity conservation, we would not be facing a situation where not only are we spending 10% of our GDP on an economic stimulus package, but the hospital costs, the human productivity costs, the loss of life that we are seeing in the last 6 months is enormous. And all these things, if we are going to account for, would mean that had we worked in the last 30 or 40 years on environment, we would have been spending all this money on much better issues than fighting a pandemic like this. In fact, in United Nations Environment Program, in our last assembly 2 years back, this nexus was something that was brought forward by the member states, that the countries need to work on the health and environment nexus much more deeply than they are. And this nexus, the areas like chemicals and waste, climate, biodiversity, another big area is antimicrobial resistance, where India really needs to work hard, and certainly sustainable consumption and production. I think we need to look at these issues from the prism of health and environment. I'm very happy to say that India is also the very first country in the world to have understood at a policy level this nexus between environment and health. And why I say this is that it was only in July, the last week of July, that the Ministry of Health and the Ministry of Environment got together to set up a steering committee on environment and health. This is really a very innovative approach and a very unique initiative which India has taken. And I don't think there's any other country that has started looking at this nexus at a policy level in a way that India has. And I would congratulate the Government of India and the two Ministries of Health and the Ministry of Environment of having taken this very, very proactive step. And I think this steering committee also comes at an opportune time when we are looking at the reasons for this pandemic. And the scientific studies that have been done for the reasons for this pandemic certainly point out to the fact that these zoonotic diseases are happening as a result of the biodiversity loss and the ecosystem devastation that has taken place in the last 40 or 50 years. And the linkage between wildlife and humanity has been brought forward so clearly in this case. So I think we should be looking at a very successful transition from a policy level towards a pollution-free planet. And this would require a very strong political leadership. It will require, as Chatterjee Sahab was saying, high-level champions and commitment, and also a lot of action at the local level. Conservation experts, I'll give you an example, like conservation experts monitoring great apes, for instance. They can be a valuable part of the zoonotic disease surveillance in communities, because community action is so important. So I think this linkage between conservation experts and the local doctors is a very important nexus that needs to be strengthened. Experts monitoring habitats also have a very important role to play. I can highlight this by an example that in 2018, livestock experts working closely with healthcare professionals in Kenya detected the Rift Valley fever and deployed livestock vaccinations and other interventions to contain its spread. And I think that is the kind of approach that is needed to address this very, very serious pandemic that has hit the whole world. And I'm very happy that the government of India is doing a lot of work in this regard now. And ultimately, I would like to sum this whole approach as a One Health approach. This is what at a global level the policymakers are wanting to highlight, that we need to have a One Health approach instead of working in silos on environment separately, on social issues separately. We need to connect all this and come up with a holistic kind of a response. We are happy that UNEP and WHO, World Health Organization, is under this steering committee that has been formed, is working very, very closely with these two ministries to take this research forward and see how we can work together to fight this pandemic. So I would again like to thank the Council for inviting us, and it's such an honor to be sharing the same platform as with Chatterjee Saab and Mr. Sim and Bhagwati ji, with whom we are working also very closely through the faith-based organizations on these issues. So thanks a lot once again.
Thank you so much, Mr. Bagai, for your wonderful insights, and also to highlight, for highlighting this very important concept, is that if we want to tackle the problems of health, we need to look into an approach of One Health and maybe one word as well, because then only we will be able to, kind of prevent the health threats which we see from multiple factors, including environment and wildlife and so many other aspects of our ecosystem. So thank you so much for that. Pranam Bhagwati Saraswati ji for joining us on this very, very important and critical discussion to understand how we as a human being, businesses, industries, and everyone need to contribute to their surroundings, to the places, to the communities we live in. You have been one of the greatest champion of that, and as I said that the one word approach also is something, and you are a real global citizen. You came from Los Angeles to settle down in a place like Rishikesh for the service of humanity. So how do you see, going forward, how we should, our businesses, our people, should take up their responsibility towards their society, and why we should keep health in the center of it?
It's such a wonderful honor to be here and to be part of this really esteemed panel. And I'm so deeply impressed, as always, by Jagran Pahel and the programs and the initiatives that the Jagran Parivar keeps taking up, because this is what we need. We need to wake up. Literally, we need to wake up from our ignorance and from our illusion on so many levels that is contributing to, leading to all of the problems that we are facing today, from the COVID pandemic to environmental destruction to war to climate change, and everything is due to ignorance, is due to us literally being asleep. So thank you, first of all, to Jagran Pahel and the whole Jagran family through all of your initiatives to really keep waking us up and to be so committed to sharing not only information, but inspiration. And I'm also so deeply touched and impressed and feel so grateful to be here with the Integrated Health and Well-Being Council, to have that vision of the role of religion and spirituality in sanitation, hygiene, and therefore health for our planet is fantastic. And to be able to be here on the day of CSR awards for COVID, because so many people all over the world are seeing COVID only as an emergency. But we have this great ability to see it, not just as an emergency, but as an opportunity to really emerge and see, to emerge from the darkness, to emerge from the fear, to emerge from the stress, to emerge from our dysfunctional ways of thinking, of choosing, of living, of eating, of doing business, and to see the possibility when we actually change that into a new way of living, choosing, eating, doing business. And when we speak about health and spirituality, the root, it's so beautiful, the actual etymology of the word health is rooted not in just alleviation of symptoms or alleviation of illness, as so many people think. Health is not just about a pill here or an antibiotic there or a vaccine here, but actually the root of the word health is embedded in the word wholeness, completeness, oneness. Within the self, of course, body, mind, soul, spirit. That's what yoga is, that union. But it's also rooted in the word holiness. And so in order for us to really have full health, we have to not only be free of viruses and bacterias and fungal infections and deadly mosquitoes and all of the things that we tend to think of as that which wreaks havoc upon our health. But we actually have to be grounded and rooted in a system of understanding the self and of understanding our place in the world of wholeness and of holiness. And this is where that crucial role, of course, of our religion and faith comes in, is it helps us understand that. But tragically, people think of religion, spirituality, and faith as that which is only rooted in Jivan ke baad jab moksha milega, ya moksha kaise milega, how after life can I be free? But actually, religion and spirituality and faith are rooted in how can we turn this life right here into heaven on earth. So it's not just about heaven after we die. It's not just about moksha after we die. So as I was saying, we tend to tragically think of religion and spirituality and faith just as that which teaches us ki jivan ke baad moksha kaise milega, how to have heaven after our life. But the truth actually is that religion and spirituality and faith teaches us how to have heaven right here on earth, how to live in heaven right here, right now. That's the role that our religion and spirituality give. And part of that heaven is a healthy body, is a healthy world, is healthy air, healthy soil, healthy water. And so religion and spirituality, it's essential for all of us to be working for clean air, clean water, clean soil, health in the body. No one should think that somehow these are the job of others, these are the job of the government, or these are the job just of civil society organizations or NGOs, and that religion and spirituality is somehow separate. No, incumbent in our deep religion, our deep spirituality, our deep faith, is that commitment to serving the world, is that commitment. And that's where we, the Global Interfaith WASH Alliance, have been so committed to working for water, sanitation, and hygiene, because we realized, as we say, sharir ek mandir hai. And when our physical bodies are not healthy, when our children are not able to go to school because their guts are ravaged by bacteria, when our daughters and our mothers and our sisters and our wives are being attacked by wild animals, or men who act like wild animals because they have to go out into the jungles to heed the call of nature, or they have to walk kilometers to get a bucket of water, they can't have help. They can't have empowerment. They can't have upliftment. And as a society, we cannot really have vikas. We can't have development until all of the sectors are really brought together. And so as we speak about CSR, it's so beautiful as you're focusing today, not just on the old paradigm of CSR, but on a whole new, broader vision of CSR, because it isn't just about thoda sa percentage of our profits, lay low, give it to some charity. That's great as a beginning, but actually CSR needs to be a whole new paradigm of how we think about doing business in the world, that our business is not separate from our air, from our water, from our soil. It's not separate from the health of the people who work in our factories, in our companies, the women, the children. None of it is separate. And so the real now new paradigm of CSR needs to be that that's concerned not just about 2% or 3% kahadena, but actually about the full 100% of business. How can we really merge doing well with doing good? How can we merge the prosperity in our companies, in our businesses, the success there, with this vision of health that is rooted in wholeness and holiness, that is rooted in the awareness that our environment, our water, the health of our humans, and also all of the species on Earth is interlinked and interconnected. Atulji spoke so beautifully about the role of our biodiversity and species extinction with so many of the illnesses that we face. And this is what our spiritual and religious traditions have been telling us for thousands of years. We're all connected. We're all one. Today, modern science, quantum physics are telling us the same thing. There's no place that any of us ends and the rest of the world begins. And so for that, as we are in the world of business, in the world of profit, in the world of prosperity, let us realize and remember, it's not separate from health. It's not separate from water. It's not separate from sanitation. It's not separate from the air and the water. Because all of that is the present and is the future. There's a beautiful teaching, I think, by His Holiness the Dalai Lama, of how tragic it is that we spend all of our health, physical health, mental health, to accumulate money. And then we try to spend all of our money to buy back our physical health and our mental health. And if rather than falling into the trap of this tragic irony, we understood that business, that commerce, that prosperity, that industry, that companies, that all of this has to go hand in hand as one whole and holy world, then not only will we emerge from the COVID pandemic and really be able to see a new normal, but we'll actually prevent all of the threats that are just lining up to wreak havoc on our life. Because today is COVID, tomorrow will be another superbug, the next day will be lack of water, the next day will be climate change. They're just lining up one after the other. This is where the way to treat all of it has to be in wholeness, in oneness, in holiness, in togetherness. So I'm so touched to see the way that our Jagran Pahel and the Integrative Health and Wellbeing Council have really brought all of the different spheres together, all of the different sectors together. And this is the way together we will create the new healthy normal for all of us, for our land, for today, and for tomorrow. And thank you so much for this beautiful opportunity to be together today. And I have some very, very special news, which is that you have a beautiful and enlightening talk by Pujya Swamiji that was pre-recorded last night because he has to be out today. But by God's grace, he was supposed to leave early this morning, but he's actually just on his way out now and has agreed to come and to give everyone 2 minutes of live darshan just before you play the video that he pre-recorded. So once again, thank you so much. And it's a wonderful blessing to be able to have Pujya Swamiji's darshan with us for a few minutes before his words of inspiration.
Thank you so much, Sadhvi ji, for your so enlightening words and to highlight for our businesses that they need to find out the path of doing good and doing well. Thank you so much for this message. So before we request Pujya Swamiji to appear for our audience and our panelists, we also need to take Jacksim today, because Jacksim has a meeting, and so I'll request Sadhvi, if Swamiji is there, we can have him for 2 minutes for his some live inputs, and then I can go to Jacksim before actually playing the video message which has been received by Swamiji.
Dr. Sadhvi Bhagwati ji, Shri Kamal Narayan ji, और Shri Atul Bagai ji, Dr. Jacksim, Dr. Divakar, Gautam ji, and all of you. मुझे बड़ी प्रसन्नता है कि अभी मैं जाते जाते साध्वी जी को सुन रहा था. साध्वी जी ने सब कुछ कह दिया है. आज आपने बहुत प्यारी पहल की है, क्योंकि मुझे अभी तुरंत निकलना है. मैंने सब अपने मैसेज में दे दिया है आपको, लेकिन फिर भी इतनी बात कहूंगा. जब बात हेल्थ की है, when we are talking about the health, it's not health of our human bodies, but health for all. If our water is not healthy, if our air is not healthy, we cannot be healthy. And Corona has shown us the way. Just few weeks of Corona, now few months of Corona, we have seen how the water the air became clear. We don't need Corona to teach us lesson. Corona has told us we are the problem. It means we are the solution. And you all together can make it happen. In 21st century, togetherness is the way. And if we all come together, we take our own responsibility, and believe me, this is possible. This can happen, and this must happen. Thank you for being here. And because I have to leave, but I wanted to see you all before I leave on the screen. And now I have one beautiful plant, a Tulsi plant. I think we must pay attention to our plantation program also, everywhere and everywhere. And this is a beautiful Tulsi plant for all of you, for all of you. और दूसरी बात ये है, क्योंकि धरती को हरा भरा रखने के लिए, इसलिए हरा भरा रखने के लिए हमारी आने वाली पीढ़ियां हरी भरी रहें. Because our children, our children's children, our coming generations, सबके लिए हमें सोचना है और उसके लिए प्लांटेशन बहुत जरूरी है. आज मैं सबको ये प्यारा तुलसी का प्लांट अर्पित करता हूँ. धन्यवाद. बाकी मुझे जो कहना है वो वीडियो में है. प्लीज यू कैन शेयर द वीडियो विद एवरीबॉडी. एंड थैंक यू फॉर creating this beautiful moment for everyone. God bless you.
Thank you so much, Swamiji, for your very precious and blessing, blissful moment for us that you spared. And I especially want you to, you must be knowing Mr. Jack Sim, who is going to speak, after you. He is the man. I heard your statement saying that our country needs toilets more than temples. And he is the man who has made making toilet his mission, his worship, and that is where I think people like you are inspiring millions of people across the world to do something which is very, very critical for the health of the humanity, health of this world. So thank you so much, Swamiji, for your time, and we look forward to hear more from your video. Before that, we play the video. I now request Jack Sim, the man who made toilet as the word agenda. And Jack, thank you so much for joining us, and in this special edition of CSR Health Impact. And I know you have a meeting to attend, so before without any further delay, I request you to share your experiences of how you have been able to bring this very, very critical movement in the world of getting a toilet for every family or for every person. Thank you so much, Jack.
Thank you very much. Having seen Swamiji, Chidanand, Saraswati, and Sadhvi, it's like meeting my family again, because I go to Parmarth Niketan and receive a lot of wisdom, and we created the first World Toilet College in Rishikesh in the same ashram of theirs. So we're very happy because the message that Sadhvi and Swamiji is saying is this: cleanliness is not just clean street, clean river, clean toilet, because the moment you are able to do that, you have a clean spirit. In Singapore, we start by cleaning the street, cleaning the toilet, cleaning the river. We can drink the water from the river very clean now. But as we start to do that, it extends to cleaning up corruption in the country. Ever since 1965, we have been cleaning up the secret society, the mafia, and clean extends completely. Today, you don't have the drugs cases. That's also one cleanliness. You don't have the corruption anymore. You don't have the police asking for money. In the 1960s, they were doing that. And you don't have any more gangsters. And you of course have clean streets, clean toilet, and clean water, and the clean habit of people. So cleanliness is the essence of mitigating diseases. You actually, hygiene is the cheapest medicine in the world. A toilet is the cheapest medicine in the world. Washing hands is the cheapest medicine in the world. And if you invest in prevention, you don't have to invest in cure. If COVID was arrested at root very early, you will not have the spread. The spread caused not just medical, but also economical hardship. So many people are without a job today because COVID causes the shutdown. But never in the history of mankind has hygiene awareness been as high as today. Today, hygiene awareness is life and death. And this is the time when everybody realizes what is sanitation, what is cleanliness all about. But in 2001, it wasn't like that. They can't even say the word toilet or shit or poop or pee. These are considered very embarrassing expression. Although we all go to the toilet 6 to 8 times a day, we pretend that we have nothing to do with it and we don't want to speak about it. This created a situation of 2.6 billion people not having access to proper sanitation. At that time, 2001, there were 6.2 billion people in the world. Today, there are 7.8 billion people in the world. Yet the number of people without proper sanitation has dropped to 1.8 billion. So you add the additional population and the reduction of people without access to sanitation, there is a 2.4 billion extra people who have toilet in the last 20 years. We are very proud to have broken the taboo on sanitation, made it mainstream, and bring it to the UN to create our founding day, 19th of November, as the official UN World Toilet Day, adopted unanimously by all 193 countries. And we could not have done this successfully alone. We are doing this with so many people, and many are included over here. Jagan Pahel, Rakit Benkaiser, Parmarth Niketan, Swamiji, and Sadhvi are all part of this effort to create this movement. Together, we also brought Akshay Kumar and Prime Minister Modi building 110 million toilets. And today, even in China, the president is now a toilet champion. What has happened is an amazing unfolding that accumulated to today, that everybody now realizes the importance of toilets. Going forward, we have built the second World Toilet College in Aurangabad, together with Jagan Pahel and supported by Rakit Benkaiser. And we have, for the last 2 years, trained toilet cleaners, casual cleaners, into professional toilet and sanitation workers, and placed 5,000 of them into proper job with healthcare and protection during their work. The sewer diver has also been rehabilitated, that they do not have to go into the sewer. In this World Toilet College, we have trained them to use machine to clear the chokage. So dignity is very, very important in the worker safety. And launching this year, we are setting up a World Toilet Standard and Guidelines publication, which will take 1 year of effort, where we are compiling all the world standards of different countries and to put them together to become an authoritative reference document. I invite all the experts in India and everywhere who is listening to this conference. If you have very authoritative guideline and publication, please send it to us so we can add it and compile it into a coherent, authoritative, good guideline so everybody can learn and share and improve their sanitation. And lastly, we are now helping to promote Japanese toilet culture all over the world, because the cleanest and highest toilet culture, we scanned the world and we discovered that the Japanese have that. And what is better than they have been exporting sushi and all kind of manga culture. It's time to export their sanitation toilet culture, and the world will be better, healthier, because everyone is sharing what they know and what they do best. Thank you very much.
Thank you so much, Jack, for your wonderful thoughts. And I must say that your struggle and your audacity of hope and your positivity and then imagination that we need to have toilet for every family, and at a time when, as you say, that word was even shy of using words toilet or shit. And I think that was the seed of when we saw our Prime Minister on his very first Independence Day speech, started talking about making the country open defecation free or building toilet. I think all that started from your a very strong conviction to bring that important difference to the life of the people. So thank you so much for your time today, and we wish all the luck going forward, also that you are able to even provide a toilet for even rest of 1.8 billion people. So thank you so much. I would request my team to play a quick message of Pujya Swamiji which he has sent.
आज सबसे पहले जागरण परिवार के अद्भुत व्यक्तित्व जिनको मैं कभी नहीं भूल पाता, व्हाट ए मैन, स्वर्गीय श्री नरेंद्र मोहन जी एंड श्री अतुल बगाई जी, डॉक्टर साध्वी भगवती सरस्वती जी, श्री कमल नारायण जी, and Mr. Jackson, what a man of determination. Shri Bhaskar Chatterjee ji, Dr. Hema Divakar, Dr. Rajiv Gautam ji, and so many of you. It's so wonderful to have you for this great initiative. CSR Health Impact Awards COVID-19. In this context, we are having this beautiful webinar today, this conference today. और मुझे लगता है कि ये जागरण की अद्भुत पहल है, सचमुच जगने और जगाने की पहल है. अब इसी तरह से जागना होगा, जगाना होगा और जागते रहना होगा, और यही जीवन है. And I am glad that you are the people who have understood. This is not only CSR, this is HSR, Human Social Responsibility. And CSR powered by HSR, Human Social Responsibility. और मुझे तो लगता है कि you people have understood the life is not to have more. Having more is great, is super, wonderful. But life is not to only have more. Life is to be more, share more, give more. That's life. And that's what is needed today. That is the true purpose of CSR. Ki whatever I have, I should share for the sake of others. That's what is needed. And that's why this webinar today, this conference today, can create the power. And we can feel this power. And I give thanks to Jagran Pahal. I have seen their work. I have participated in that. We have worked together. And Jiva, even today, Global Interfaith Wash Alliance is also one of the logo partner. And not only logo partner in logo, but the logo partner with all the people, with everyone, to bring people together. That's what we have to do through our initiatives, institutions. And Jagran Pahal is very creative पहल, very creative initiative. और आज हम सबको एक ऋण चुकाना है, और उस ऋण को चुकाने के लिए हम सबको एकत्रित होना है. एंड जिन्होंने ऋण चुकाया है, जिन्होंने कुछ किया है, आज उन्हीं को अवार्ड मिल रहा है. ये बहुत बढ़िया बात है, उन्हीं को अवार्ड मिल रहा है. दूसरी बात, to me, because I was very young when I came to this life, and I was taught that life is to learn. When you learn, then you earn. And when you earn, then you return. The total life is confluence of sangam of learn, earn and return. And this is the time to return. आपने खूब कमाया और अब टाइम आया है how to return. You have earned so much. And from that earning, through their companies or from your own life, your time, talent, technology, tenacity, through all of that, you are sharing to the community. I'm so proud of you. God bless you and I love you all. और दूसरी बात, छोटी सी गिलहरी, a little squirrel, when the Ram Setu was being built, a little squirrel came forward and gave her share. आज हमें भी यही करना है, यही योगदान देना है. और सच मानिए, जीवन से बढ़कर कोई बड़ा इन्वेस्टमेंट नहीं है. अपने जीवन को इन्वेस्ट करिए, खुद को इन्वेस्ट करिए, खुद में इन्वेस्ट करिए. इस सेल्फ ही वर्ल्ड में सेल्फ में भी इन्वेस्ट करिए और सेल्फ को भी इन्वेस्ट करिए. कॉर्पोरेट सोशल रिस्पॉन्सिबिलिटी, CSR मेरे लिए तो एक स्वेच्छा से की गई सेवा है. सामाजिक दायित्व, गरीबों को, असहायों को, वंचितों को सुरक्षा देने के लिए आप लोग आगे आए हैं, अपना जीवन दिया है. मैं समझता हूँ ये सबसे बड़ी सेवा है. मानव सेवा, माधव सेवा. क्या मार सकेगी मौत उसे, औरों के लिए जो जीता है, उसका हर आंसू रामायण, प्रत्येक कर्म ही गीता है. यही रामायण है, यही गीता है कि हम अपने जीवन को दूसरों के काम में लगा दें. किसी के काम जो आए उसे इंसान कहते हैं, पराया दर्द पहचाने उसे इंसान कहते हैं. हमारे शास्त्रों में कहा है 100 हाथ से कमाओ, 1000 हाथ से बांटो, क्योंकि बांटना प्रसाद पैदा करता है जीवन में, जीवन को प्रसाद बना देता है, और बटोरना जीवन को विषाद बना देता है. इसलिए प्रभु ने अवसर दिया है, आइए सब मिलकर खूब कमाओ, खूब बांटो. ये अंशदान नहीं, ये महादान है. इंटीग्रेटेड हेल्थ एंड वेलबींग काउंसिल एंड वर्ल्ड टॉयलेट ऑर्गेनाइजेशन and many other organizations who have come together to have this great celebration. I think this is wonderful and I'm so proud of you all. और मैं पुनः आज जिनको अवार्ड मिल रहा है, मैं उनके जीवन के लिए मंगल कामनाएं करता हूँ और याद दिलाता हूँ कि आप जैसे लोगों ने इस देश को, इस विश्व को रहने लायक बनाया है. देश हमें देता है सब कुछ, हम भी तो कुछ देना सीखें. देश की उन्नति के लिए सबका योगदान जरूरी है. ये हम सबका नैतिक दायित्व है. इसके द्वारा हम अपने देश, समाज को सशक्त और आत्मनिर्भर बना सकते हैं और अभावग्रस्त नागरिकों की दक्षता को, क्षमताओं को बढ़ा सकते हैं. छोटा सा आपका अंशदान पता नहीं कितना बड़ा जीवन किसी को दे सकता है, कितनों के जीवन को सुधार सकता है, कितनों को लाइफ दे सकता है. इसलिए आइए पुनः सेलिब्रेट करें इस जागरण पहल को, और यही पहल ही सबकी पहल हो. धन्यवाद.
Now I would request Dr. Hema Divakar from Artist. She has been championing the cause of women and child health and has been, trying to bring that very, very critical intervention, especially in the area of anemia, and the other nutritional problem as well as the primary health care problem. Dr. Hema Divakar, how do you see CSR helping you to achieve what you want to achieve in the area of women and child health?
Namaskar, with pranams to Pujya Swamiji and Sadhvi ji, and greetings to Kamal ji and his whole team, and very distinguished and accomplished members whom I can see that galaxy being connected to our entire audience. I must confess, Kamalji, that listening to all the previous speakers, I must say that Diwakar and myself are like new kids on the block. It looks more in connect with what Swamiji said about HSR, the human social responsibility. That's where we started from. And the inspiring words for us were from Mahatma Gandhi, who said, be the change you want to see. And we were so much focused and passionate about the quality care and reaching care to every girl, every woman, that we thought that why the quality should stay only in the ivory towers of Diwakar's hospital. Why can't we give and, magnify it, amplify it everywhere? And then we, at that point of time, thought CSR means corporate social responsibility. We are not corporate in that sense. As Swamiji said, we've not earned a lot of money to give away, but we have the knowledge, we have the skills. Is it not something that we can give? Is it not some bit of our contribution? I fondly remember the Nobel laureate Satyarthi, who in his acceptance speech of when he was receiving the award said, the house is on fire. Everybody were, panicking and running here and there. And then there was this little child who just fetched a small pail of water to quench that fire which was there. And then everybody ridiculed that child, saying, oh, how will this help? And the child just said, I'm doing my bit to avert this crisis. So we are in the same position as Bhaskar Chatterjee said, that this component of CSR in our mission to connect and collaborate, yes, we can sustain and scale the SDGs to the best possible extent, not only in our country, but in the whole of Asia. That's why the Asian Research and Training Institute for Skill Transfer, and then when Atulji said environment, we believe that women's health is nation's wealth. Why? Because the environment within the womb of the mother, that is the most crucial environment that we have. The child is first exposed to even before it comes into the environment in this world. And about empowerment, the man behind making me feel empowered is none other than Dr. Diwakar. So the kind of environmental support that we should have to move ahead. And I really, really sincerely appreciate that in our endeavor to train and build the capacity of all levels of healthcare workers, which got us to the next level of seeing what really the country needs, that is the research component, and then to do the advocacy hand in hand with ISW Council, Jagran Pahal, and everybody, just about everybody whom we connect with, because people need to know what they need. And that has come to the forefront, as every other speaker here has said, that yes, indeed, the positive thing that Corona pandemic has done is to get us together with a level of introspection and reflection to do better, to make this world in keeping with good air, good water, good health, and make it reach just about everybody. Namaskar, and thank you so very much for having us on this platform. Your association has only inspired us to believe in our own potential to do as much as we can, and we will walk our talk. Thank you.
Thank you so much, Dr. Diwakar, and definitely we get a lot of inspiration from you. I'll just quickly take Dr. Rajiv Gautam from Horiba. They too have been a very consistent partner of ISW Council, and this whole event of CSR Health Impact 4th edition is being supported by Jagran Pahal, Artist, and Horiba. Dr. Rajiv Gautam, how do you see CSR helping and improving the health of the nation? A very quick remark from you. I'm sorry.
Thanks, Kamal. I think we are running out of the time. I understand it, but it has been the elite panel. So they were much better speaker than me. So we have heard it. Quickly, I said it that I would like to thank ISW Council for inviting me for this event and organizing this event. However, the Horiba has been, as a Japanese organization, has been on forefront to support this COVID time and the CSR converting from quantitative to qualitative which makes that money counts for the health reasons, and it's in COVID times, it makes more sense for. So we also did a bit of with NGOs, Sahyog Care for You, Sharda Devi Charitable Trust, with our own plant. We have done a lot of sanitizers distributions and everything. So ultimately, we thought it that utilize our bit of our funds, convert into a qualitative need for all the people. And I would like to thank again. I don't want to take much time. I don't know whether any further speaker is there, but we have done a bit from Hariba's side for this noble cause of CSR, or which Swamiji said HSR. I think that's a very good terminology. Thanks, Kamal.
Thank you so much, Rajiv ji. Thank you so much for being kind of and being precise on your remark. Thank you so much. So this was our inaugural of 4th edition of COVID-19 Special CSR Health Impact Awards and Summit, which is our endeavor to bring together all stakeholders to invest in the the life, in health, and for larger, greater dividends for business, for the country. Thank you so much for tuning in with us for this very, very important program.